Hi, everyone. My name is Dr. Michael Wald. I've been in the holistic healthcare industry, you might say, for over 30 years. I originally began as a chiropractor, then earned my master's degree in nutrition and my PhD degree in philosophy. I'm also a sports nutritionist. I provide acupuncture. I'm a life coach. And yes, I even went to medical school. I earned my MD diploma, but I am not a licensed medical doctor. The reason I did all these things is because I have a thirst, a quest, an excitement for longevity and healthcare. And today's conversation, I think you will see, reiterates that. This is about a medication that's in the news recently for its potential abilities to slow the aging process in various ways, to reduce cancer, and possibly to help other autoimmune conditions. The name of the talk today is the Rapamycin MTOR Longevity Detour, because this drug will take you in directions of longevity that we probably, I should say, we rarely see. So I believe that the potential for this drug is enormous. I'll begin with a disclaimer that this information is just for educational purposes. It's not meant as a substitute for sound medical or health advice. So why don't I just start with how rapamycin works and the mTOR mechanism, which is the target of rapamycin. So rapamycin is an mTOR inhibitor originally used as an immunosuppressant, and now it's studied for its potential to promote longevity by promoting various mechanisms that mimic caloric restriction, which we know enhances lifespan, at least in mice, and reduces cellular aging. So rapamycin works by slowing down cellular growth and cell division, enhancing what's known as autophagy, and reducing chronic inflammation, which are key factors in the aging process. And autophagy is basically the process that describes how the body cleans up cellular processes. So sirolimus is the chemical name for rapamycin, just so you know. And as I just said, the biochemical name of the drug rapamycin is sirolimus. This is the chemical formula, and it is a macrolide formula, and the macrolide family of medications are generally and primarily used as antibiotics, just like I gave one example here of erythromycin, an antibiotic. And basically, it's the macrolides inhibit bacterial protein synthesis, and this is a mechanism of action that also has anti-cancer effects. So what are rapamycin's uses, effects, and side effects? What are its interactions? And what sort of monitoring do we need to do to make sure that if this drug is used, it is used the correct way? I should also take this opportunity to say that each person is quite individual and they will react very differently to this medication. So the testing I talk about here, the nutrients and foods that may help rapamycin or interfere with it, they may be different from one person to the next. Okay, so what are the primary uses of rapamycin in traditional medicine? So they use it mostly to prevent organ transplant rejection because it's an immunosuppressant. When someone gets organs from another person, there's an autoimmune reaction. It's often quite severe, and if people are not on immunosuppressants, they will reject the organs. So rapamycin reduces that reaction. And it's used to treat certain cancers, such as renal cell carcinoma. And also, investigations have shown that it may have potential longevity and age-related effects, slowing the process of aging by inhibiting mTOR. And mTOR, MTOR, by the way, stands for mechanistic target of rapamycin. So that's the mTOR. It's a pathway linked to aging and cellular growth. Now, its intended effects also include immunosuppression, so the body can more favorably accept foreign organs during organ transplantation. And the way in which rapamycin works is that it reduces the mTOR activity, potentially delaying age-related cellular damage and promoting autophagy or cellular repair. That's what we want in any longevity or anti-aging attempts. You should know, though, if you're thinking of using this medication, of certain drug-nutrient interactions, both the positive ones and the negative ones. You will not hear all of them in this talk, but I've outlined a few of the more common ones that you should definitely know about. So there are synergistic substances with rapamycin, and they include a phytonutrient known as resveratrol. It's more commonly known to be in wine, for example. Also NAD plus precursors like NMN or NR, and also the drug metformin, which is a drug used for diabetics. When you use rapamycin and metformin together, it seems to work even better for cellular repair and regulating metabolism. And then there are some antagonistic, some negative interactions that can occur with high doses of combining rapamycin with leucine, which is an amino acid, which has many positive effects on the body. But if you're going to take rapamycin, you need to be aware of the negative interactions with leucine. Also, it has antagonistic reactions, rapamycin, with insulin-boosting supplements, as these particular compounds activate mTOR, counteracting rapamycin's effects, which is to not activate mTOR, but to depress it. Rapamycin is an mTOR inhibitor that shows promise for longevity. That's the key point. The reason it has such effects in the longevity area is because, in part, it reduces cellular aging, promoting autophagy, a process, as I've said a few times, that removes cellular debris. And by downregulating the mTOR pathway, rapamycin governs cell growth and metabolism. Rapamycin mimics the effect of caloric restriction and is linked to lifespan extension in that area. Rapamycin also improves mitochondrial function by reducing inflammation and delays in age-related diseases like neurodegenerative diseases and cardiovascular diseases. So at the very minimum, this drug may stave off or delay the early onset of preventable chronic diseases and acute diseases. What are some of the potential side effects of rapamycin? Mouth ulcers, nausea, diarrhea, and abdominal pain, fatigue, and headaches are very common ones. The extremely serious ones are immunosuppression, which can increase infection risk, delayed wound healing, elevated cholesterol and triglyceride levels, kidney dysfunction, and lung inflammation, like pneumonitis. So what are some foods and nutritional supplements that may interfere with rapamycin? So grapefruit, by the way, is a food that interferes with countless medications. You should ask your pharmacist or consult a physician's desk reference book to see the enormous number of medications that are adversely affected if you eat grapefruit. So grapefruit and grapefruit juice. The problem with this is that the grapefruit will inhibit a detoxification enzyme in the liver known as cytochrome P450, a whole group of enzymes which increase rapamycin levels and can raise the toxicity potential of rapamycin. Also, high-fat meals, they may alter the absorption of rapamycin and reduce its effects even further. Supplements such as St. John's wort lowers rapamycin levels by inducing this cytochrome P450 system. And also, antioxidant overuse, like high doses of vitamin C, may interfere with rapamycin's oxidative stress mediated mechanisms. So rapamycin creates oxidative stress, which is a benefit. Mostly you've heard that oxidative stress is a negative, but it depends on the scenario. If you take an amount of vitamin C that acts as an antioxidant and you want the oxidative effects of rapamycin, that's obviously an antagonistic relationship. So what are some of the tests, the blood detective tests, I would say, that you would use to monitor this drug? And also, there may be other tests that may be used to monitor your progress, which I'm not mentioning here. Each person, as I've said, is unique and different. So rapamycin levels, we always want to know the level of the drug. We want to make sure it's a level that is the minimum amount that produces the desired effect. Okay, and if it's for organ rejection, it's one level, and if it's for longevity, it may be another level, and even those levels with particular individuals may be adjusted even further. We need to look at our blood lipid or fat levels, particularly cholesterol and triglycerides, because rapamycin can increase those. We want to look at a blood count to monitor for anemia and white blood cell suppression. We don't want that going too low. Liver function tests, which are the ALT and AST tests to look for liver toxicity. Also kidney function tests, which include creatinine and blood urea nitrogen, BUN for short, to monitor kidneys' responses to rapamycin, and blood glucose levels, also including the 3 to 4 month average of blood glucose test, hemoglobin A1C to check for rapamycin-induced hyperglycemia. That means raising blood sugar too much. So the key point here is that rapamycin does offer promising therapeutic effects upon longevity, but does still require careful dietary considerations, nutritional supplement avoidance of certain ones. I've mentioned a couple in this talk, and regular monitoring of blood sugar and other particular or potential side effects. So in short, we want to approach taking this medication, rapamycin, from a holistic perspective, because we need to look at diet, we need to look at exercise, we need to look at stress levels, we need to look at sleep, we need to look at what supplements people are taking, what medications they're taking, and I may need to talk with several doctors that you're working with. That is what holistic-minded approach is. And we want to approach rapamycin from a healthcare perspective, not merely a disease care perspective. That means that if you're really looking at participating in a longevity healthcare plan for you, you need to have your labs checked more often than if you were waiting for a disease to happen. You would want to be working on specific things over a period of time if you are serious about your longevity efforts. Some people think they're going to come to me, for example, for a visit, and they're going to be set for the longevity recommendations for the rest of their lives. And it's true, I can give quite a bit of information and practical advice during a single, let's say, hour-long consultation. But sometimes we need to retest tests, we need to make sure that the levels of nutrients are at therapeutic levels, and there are just reasons to monitor a person appropriately over a period of time with specific longevity goals in mind. And we also want to use lab a little differently. The blood detective method, which I pioneered, means that when you get blood tests done, you've all had blood tests done at your doctor's office, there are ranges of normal, the low end and the high end. And then those ranges are based on people your age that are men or women, and you're compared to them. But you're not necessarily compared to men or women your age that are the healthiest people in the population. They have very different labs, by the way. So I compare people to healthy people and shoot for that rather than just average. That's why so many times you'll visit your doctor, they'll tell you your labs are normal and you're not feeling well, and they stare at you like you're a deer in the headlights, because they don't really understand health. We do not have a healthcare system. We have a disease care system. Just ask any of your doctors questions about health. The most they'll tell you is to exercise and eat right. That's about it. Exactly like that. And in terms of doing the testing, you'd have to go to 12 different doctors, and I'm not exaggerating, for all the different types of longevity biomarkers that you might be interested in the area of longevity. But I can perform them all at once. Or sometimes I write letters to doctors to perform the tests if insurance is an issue. So there are ways around all this stuff. And then ultimately, based on your laboratory, based on a careful consultation, a physical exam, nutritional visual exam, and other evaluations, I recommend food choices based upon longevity goals, along with exercise, sleep, stress reduction, nutritional supplements, the whole holistic gamut. And finally, thank you very much for listening to this presentation. I'm Dr. Michael Wald. I practice both in Westchester County, New York, and Richmond, Virginia. You can give me a call at 914-552-1442 if you'd like to schedule a no-cost 15-minute call to discuss your needs with me. Or you can email me at info@blooddetective.com. And absolutely do visit and take advantage of the large amount of information and articles and podcasts that I have on the website at www.drmichaelwald.com. Thank you so much again for spending this time with me, and I'll see you during another presentation.